Hello and welcome to the LifeTec webinar on back pain. My name is Grice. I'm one of the occupational therapists in the Townsville office. For those of you who might not know who LifeTec is, we are a social enterprise that provides information, education, and advice on assistive technologies. So we enable solutions, and we do this via our interactive display centres. We have one in Brisbane and one up in Townsville. We also have an inquiries phone line, which is a 1300 number. Anyone throughout Queensland can call to inquire about an issue they're having with any kind of daily activity, and our therapists can provide assistance and advice via phone or email. We also do outreach services, so we do cover the majority of Queensland, and we have the ability to take equipment out to trial with people. We also have the ability to meet with other therapists and assist them to problem solve. And our education, so our education calendar can be found on our website at www.lifetec.org.au. So this includes free webinars, workshops, and that kind of thing as well. So holding back, comfort in sitting, bending, and reaching. Our learning objectives for this session, so we'll explore the basic anatomical structures of the back and spine, gain an understanding of some spinal conditions that are associated with acute and chronic back pain, discover a range of assistive technology that may be useful for the management of such conditions, and develop an understanding of the basic considerations when choosing AT for back pain. I'd like to let you know if you do have any questions about this presentation, please forward them to myself at katie-ann-grice@lifetec.org.au. So we'll start with the spine. So we have 24 vertebrae all up, and in the picture you can see the natural curves of the spine. So we have a cervical C1 to C7. Thoracic, we have 12 vertebrae, lumbar is L1 to L5, our sacral, which is S1 to S5, and our coccyx as well. Just looking a little bit closer at the structures, our spinous processes, these serve as attachment points for muscles and ligaments, and they can be palpated. The vertebral body or column allows for the nutrients as a passage to intervertebral discs and provides strong support for the head and neck. The intervertebral discs act as shock absorbers and separate each vertebrae, providing flexibility. They can be prone to damage if the spine is subjected to excessive force or overuse. Spinal nerves extend through the opening between each vertebrae, one left, one right, and branches off through the rest of the body. The spinal cord encased by the vertebral column, and it relays information to and from the brain. And then our ligaments as well. So ligaments around the spinal column act to limit hyperflexion and extensive movements of the spine. Our musculature of the back, obviously this is designed to support in sitting and standing in the upright position and not lifting and taking loads of items. These kind of movements we're looking at are extension of the vertebral column, maintenance of the erect posture, stabilization of the vertebral column during flexion, lateral bend, and also rotation. Soft tissue surrounding the spine can play a key role in back pain, and the complex muscle groups that support the spine assist with holding the body erect and allow the trunk to move, twist, and bend. Having a closer look at pain, our acute pain generally lasts for a few days to a few weeks. Most acute episodes are mechanical by nature, so something like trauma to the lower back, and this can be caused by things such as sports injuries, work around the house or in the garden, or a sudden jolt caused by something like a car accident. Symptoms can include muscle aches, nerve issues, like radiated pain, also limited flexibility or range of motion. Some acute pain syndromes can become more serious if they are left untreated. Chronic pain is measured by duration, and it is the pain that generally persists for more than 3 months. It's often progressive and can be quite difficult to determine. Facts and figures. So although back pain and back problems are most common amongst young and middle-aged adults, it has been known to affect children as early as 8 to 10 years of age. It has been estimated that 70 to 90% of people suffer from low back pain in some form at some point in their lives. And pain is a key symptom in most back problems. One study of people with long-term back problems suggested that 14% experience constant or persistent pain, and 86% experience pain 1 day per week. Looking at some of the associated conditions with back pain, bulging disc. So this is where the intervertebral discs are under constant pressure, and as they degenerate with age, the annulus pulposus can weaken, causing the disc nucleus to bulge outwards. This can lead to herniation, which can cause compression on the surrounding nerve root. Studies have demonstrated that most herniated discs occur in the lumbar spine. There are also occasions where a herniation leads to much more serious complications of a ruptured disc, which can lead to permanent neurological damage if left untreated. Sciatica. Sciatic pain can often be caused by injury or compression of the sciatic nerve. This can cause pain to radiate down the posterior leg and can also cause weakness, numbness or tingling in the lower leg or foot. Spinal degeneration. So degeneration of the spine is obviously a natural part of the aging process. It is a major cause of chronic disability in the adult population, and it can occur in any of the structures surrounding the spine, including the bones, joints, ligaments, muscles, nerves, and discs. Spinal stenosis. So stenosis is a condition that refers to the abnormal narrowing or stricture of the spinal canal, and that results in pressure on the spinal cord and or nerve roots. It can involve a small or large area of the spine and can cause numbness on the peripheral areas of the body, depending on what level of the spine is involved. Osteoporosis is a condition in which the bones become fragile and brittle, leading to a higher risk of fractures. It occurs when minerals such as calcium become depleted faster than the body can replace them. This results in loss of bone thickness, both density and mass. Spondylitis is a form of arthritis that primarily affects the spine, although other joints can be involved. It can lead to chronic pain and discomfort and can lead to a spinal fusion, which can cause a fixed kyphotic posture. Looking at some treatments now, so focusing on acute medications such as anti-inflammatories and paracetamol are effective in treating most cases. Alternation of hot and cold treatments can be an effective way to manage pain. Positioning during sleep, so ensuring that the spine is aligned as much as possible. We'll discuss various supports that can be used to achieve this later. Relaxation. Research suggests that people who manage a positive attitude tend to have a decreased recovery time. Exercise. This can range from gentle activity at home or a short walk around the block or to the shop. The distance must be manageable and not cause excessive pain. And we have lifestyle. So common causes such as posture, stress, and being overweight can exacerbate back pain. It's important to minimise these factors as much as possible. Looking at treatments for chronic pain, pain clinics. So private and public pain clinics can assist their clients to gain a greater understanding into their condition, as well as learn techniques to help manage their chronic back pain. This is done with the assistance of a multidisciplinary team, including occupational therapy, physiotherapy, psychology, and general practitioners. Various health professional treatments such as physio, chiropractic services, massage therapy, acupuncture, and counselling. Exercise programs, so involving multiple sessions ranging over a period of weeks. And last but not least, surgery. So this is a last resort treatment when all other options have failed. It can include spinal fusion, which is a procedure where 2 or more vertebrae are joined to eliminate the pain caused by abnormal motion. Another procedure, which is less invasive, is the laminectomy, where the lamina is removed from the vertebrae to decrease the pressure placed on a prolapsed or herniated disc. So one thing I did think was very important to bring up was that assistive technology may assist with the alleviation of some pain, but it is definitely not the sole solution. I'll just remind you again, any questions, please forward them to myself, Katie-Grice at lifetec.org.au. So we'll start by looking at some various AT that can be used within the bedroom, starting with our transfers. So self-help poles, they can assist the user to position themselves further up in bed or to help them into a sitting position prior to transferring into or out of bed. Bed rails also assist with positioning and lying. So the one pictured is a K-care bed rail, which has a vertical surface to assist the client to roll over and change position, and a horizontal surface which assists them to transfer and balance. Leg lifter. So the leg lifter is a flexible, reinforced webbing strap with a loop at both ends. It is used to assist in lifting the user's legs on or off of a bed or wheelchair. The small loop is held in the hand while the other loop is lowered and placed over the foot. This then provides a means of reaching and lifting the leg. Bed ladder. The bed ladder can be made of nylon cord with 4 sort of rungs made out of rigid plastic. It is secured into position with a long cord at the base of the ladder, which can be tied or hooked around the end of the bed. A person can walk up the ladder with their hands and so assist themselves to sit up in bed. Positioning. So there are a variety of supports available to assist with positioning and lying. The aim of these are to maintain the natural curvature of the spine, which will help to alleviate some pain. The picture to the far right represents a bed wedge, which is placed at the head of the bed and supports as low as the sacral area when lying supine. Wedges can also remind people to sleep on their backs, which places them in a more neutral positioning as opposed to side lying. So we have the pillow support, which is a plastic coated metal framed ankle adjustable backrest, which is also designed to go on the top of the mattress and provide back support in a sitting position in bed. Just an example, the Serenity pillow, the Vitapedic Serenity pillow, is a foam pillow contoured so that the middle is lower than the sides to allow contouring with the user's neck shape. The top layer is dimple egg carton foam, glued to similar grade foam used as base. It's covered with a polycotton fabric and it may be suitable for people with neck or back pain. And the bottom picture represents a leg relaxer and memory foam head pillow, which can also assist the user to place their legs in a more neutral position, alleviating the pressure on the lower back. Mattresses. So now that we've looked at cheaper options for positioning and support in the lying position, these are a few more expensive options. Overlay. So I've just got an example of the Row Home Mosaic overlay, which is an air overlay. It is similar to the air-filled cushions. So the air aims to envelope the individual, providing maximal support across a larger surface area. Not only is this good for pressure relief, but it can also alleviate some back pain. Convoluted foam overlay, again, aiming at providing cushion comfort. Electrically adjustable bed, or hospital bed even. So these come in all shapes and sizes. Aesthetics obviously vary, with some appearing more hospital-based or clinical, and others are designed to fit into the home environment. These beds adjust via remote control and can cover a range of positions, including head raise, leg raise, tilt, height adjustment to assist with the transfers. Some will also have additional features, including massage element or Trendelenburg features. And then we have mattress replacement systems. So mattresses fabricated from latex, just as an example, are designed to provide uniform support on the body, minimizing pressure, inducing the hammock feel. Moving on to sitting and support. Backrests. So back supports are very subjective in that it will depend on the user's comfort. All supports aim to maintain a good posture through supporting the natural S-curves of the spine. Back supports fabricated using various materials with different foams being quite common. Different densities are available which allow the user to select the size and shape that best suit them. So neck supports, although chronic pain is a less common place to occur in the neck, they are available for comfort and positioning, and they aim to provide good support contour while seated. Can be used in vehicles, at the office, home, or even on an aeroplane. Facet lumbar support. So these were originally designed to be used in vehicles, but can be adapted to use on most chairs. Comes with a strap that can be secured around the back of the chair to keep the support in place. It is a lightweight option that is easily transportable, and there is a heavy-duty version available as well. The Backdraw Posture Plus, which is a nice cheap option. It's a curved portable sitting device designed to correct sitting posture. Made from flexible plastic and covered with a soft fabric. The contours cradle and support the bones at the base of the pelvis, enabling a neutral spine position. And then we have the Spinese Massage Backrest Cushion. So it's a contoured backrest with battery-operated massage. It is curved to maintain the S shape of the spine as well as support the body in an upright position. Cushions. Looking at our coccyx cushion, so obviously there's a cutout at the rear of the cushion to alleviate the pressure on the coccyx during long periods of sitting. Our wedge cushions, and to place the pelvis in a neutral position, which will encourage the user to maintain a good posture and relieve lumbar spine load during sitting. These cushions are designed to be lightweight and can be used at home, work, or in a vehicle. Air cushions. So again, the Rojo Mosaic, as an example, is made from polyvinyl and features rows of interconnected air cells, which allow the flow of air to conform around the shape of the user. Gel cushions. So we have the EquaGel here, and it's fabricated from a polymer gel in a honeycomb type shape. It aims to envelope and immerse the user's pelvis to provide more support and cushioning. Seating in the home. So we have a high back chair. So with this particular one is the K-Care one, and it has an epoxy coated metal frame featuring height adjustable legs and an adjustable depth and angled seat. The contoured high backrest provides support for the whole length of the back, neck and head. Electrical lift chair. So this style of chair is electrically operated by remote control and assists the user to transfer to a standing position with minimal effort. They also go into full recline and leg elevation, which will allow the user to change their position and relieve their pain. Looking at personal care tasks at home, beginning with showering and bathing. Tub transfer bench. So they're designed to assist users who have difficulty transferring in and out of the bathtub. Most have height adjustable frames that are made of lightweight aluminium with plastic moulded seats. There are drainage holes situated to prevent the build-up of water, and it is reversible to allow for access from either the left or the right side. Shower chairs, designed specifically to be placed in a shower cubicle with sufficient room. They also have epoxy-coated frames to prevent rust and rub and non-slip seats, height adjustable legs, so the user can sit down if their endurance is limited due to pain. Shower stools. So these are more designed for people who require something to sit or perch on during their shower, and obviously if there is also limited space. Some models do offer a backrest, however most are equipped with the non-slip feet, height adjustable frame and armrest to assist with transfers. And last but not least, our grab rails. These can be installed to provide a sense of security and balance when transferring into or out of a shower or bath, and can also help take that pressure off the lower back. Looking at washing, handheld shower hoses, so these can be used in conjunction with a shower seat to make washing easier. The water is better controlled and the user can manage this with minimal awkward movement and without the water flow directly hitting them in the face. Toe wash shower and long-handled sponges. So these are washing implements with long handles that allow the user to wash various parts of their body while maintaining their upright posture. The toe washer eliminates the requirement to bend while washing the feet, which can also help prevent falls on a slippery surface. Some longer handled sponges can be bent and able to easily reach the back, so like the one in the picture. And then we have our shower sandal. So this is a foot washer designed to clean the entire foot without any bending or stretching. It's a plastic sandal with synthetic bristles and suction cups that attach to the floor when pressure is applied with the foot. Toileting. So toilet seat raisers. So these usually made from a polyurethane plastic, and they're an extension of your toilet bowl. So they're held in place via 2 or 3 bolts that wind in and grasp the top of your toilet bowl. The height of the seat means that the user doesn't have to transfer as low on the toilet. Some models, like the one pictured, have armrests included, which can help ease the transfer even better. Over toilet frames, a height adjustable toilet seat without making any permanent adjustments to the fixture or adding any grab rails to the walls. It's epoxy coated with rubber non-slip feet, and it's suggested that a splash guard be fitted inside the toilet seat, as it's a good way to maintain hygiene and make cleaning easier. Bottom wiper. So this is a lightweight device with a looped handle, angled shaft and moulded plastic end. Toilet paper is wound around the plastic end and secured into the serrated edge. It is designed for frontal use, so it minimises that twisting. And bidets. So electric bidets take a different approach to toileting hygiene for clients and also carers. Bidets provide washing and drying functions which allow the user to maintain independence and dignity during toileting tasks. Anyone with limitations in twisting and bending of the lower back may benefit from one of these. Clothing and dressing. So stocking applicators. So the one pictured the top left is the Easy As. So this is a rigid plastic structure designed to assist with fitting closed and open pressure garments to upper and lower limbs. Available in 3 sizes, so the yellow is the medium size, and an optional handle can be attached to pull up the applicator. Homecraft Terry Cloth Sock Aid. So this is a flexible plastic sock aid designed to assist people who cannot bend to reach their toes to don socks. The aid is fitted to fit around the heel and has a nylon inner cover and a terry cloth outer cover to prevent the aid from sticking to the skin of the sock. Shoehorn. A plastic shoehorn with contoured handle designed to assist the user to fit their shoe and foot together. And dressing sticks. So these feature a double hook at one end, which assists in pulling up or removing garments such as docking socks and stockings and pulling jackets and shirts over shoulders. So therefore there's limited bending and awkward postures. Mobility. So we start with walking sticks and crutches. So no matter the cause of back pain, walking may be painful. As mentioned earlier, gentle exercise can be beneficial to ease symptoms. When walking, the back muscles are primarily involved in maintaining balance. If the workload is reduced, the pain will more likely be reduced. When first starting to exercise and walk, people will experience some tenderness, but it's important that the exercise should never make the pain worse. It is important to start gradually and take necessary precautions. So we have a single point sticks. So the use of one of these can reduce the amount of pressure placed on the back and knees during ambulation and provides a light support. Quad stick in the middle there. So either a 4-point stick or a quad stick, and they can provide increased balance and support with 4 feet in contact with the ground. And our crutches. So the use of crutches obviously support the body bilaterally and also assist with the conservation of energy that is ordinarily used to assist with balance maintenance. Walkers and frames. So wheeled walkers. So when a hopper frame is used, the frame is required to be lifted, but a wheeled walker is obviously pushed along the floor, eliminating that need. It's also assisted the user to walk with greater speed. Four-wheeled walkers provide more stability than three-wheeled walkers, which are really not recommended if balance is an issue. And they are foldable and storage and transport as well. A little step up from the wheeled walker is a forearm support walker. So in some situations, people find it more supportive to utilise one of these. They can be good for users who have secondary conditions such as arthritis and decreased grip in their upper limb. Correct setup is vital, as additional postural problems can occur with shoulder positioning. This style of walker is quite heavy, which can be a disadvantage, and it's not so transportable. Wheelchairs, so in extreme cases of back pain, a user might find it more comfortable to use a manual wheelchair for long distances in the community. It is still important to maintain exercise regimes and walk short distances. Additional backrests or cushions may be required to provide the correct postural support for the individual. Backrests can be retrofitted to manual wheelchairs in most cases, with lumbar or lateral supports integrated. Attendant-propelled chairs, so lightweight, easily transportable in a vehicle, however, the user is unable to propel themselves if required. Self-propelled, these frames are obviously heavier, however, they can be dismantled into smaller, more manageable parts. The user is able to propel themselves or be pushed by an attendant. Scooters and powered mobility. Some people find that travelling longer distances, a scooter or powered wheelchair may be an option, although it should never be used as a last resort. Sorry, it should be used as a last resort and not relied on completely for mobility in the case of back pain. They come in a range of sizes and have many different options available. It's important to seek advice regarding what is suitable for your client. Moving on to vehicles. So we start with car transfers. To the left there we have the handy bar. So this is a portable handle which is fitted into the car door lock striker. Once located, it assists the user to transfer in and out of the car seat by providing a rigid support handle. The handle has a slip-resistant foam padded grip and can be used independently or by an attendant using the person in and out of a vehicle. Also incorporates an emergency side window breaker and a stainless steel emergency belt capper. The swivel turn pad, so this is a soft foam swivel disc with slippery inner surfaces and slip-resistant top and bottom. It is designed to allow a user to pivot around 180 degrees with or without assistance. It may be used in the bed or in a car or to transfer from one chair to another. Then we have our seatbelt handle. So this is a plastic seatbelt richer that clips onto most flat-sash seatbelts and reduces the reach required to pull the seatbelt across the torso. Now we'll look at moving mobility devices into vehicles. So we have the wheelchair boot slider. It's designed to assist a person to slide a manual folding wheelchair into the boot or car. It consists of a padded boot blanket, a nylon slider with a platform, and a ground protector. The folded wheelchair is placed inside the nylon slider and using the two attached handles, it is raised and then slid into the boot. The rim of the boot helps support the wheelchair weight. We have the Burt wheelchair carrier, so that's on the right-hand side. And so this is a metal frame that's mounted to the tow bar of the vehicle and is designed to carry a folded manual wheelchair. The frame pivots on the mounting so that when the wheelchair can be rolled into the frame rather than lifted. Our model is also available to carry an attendant-propelled wheelchair with small rear wheels. And then there are various scooter lifters. So there are external lifting devices available to transport scooters and some powered wheelchairs on the back of the vehicle. They're usually designed for smaller models and power chairs. The device automatically lifts and lowers the scooter from ground level via power from either the vehicle's battery or a power pack. Looking at the workplace, so focusing on ergonomics, so all good postures can be a cause of back pain sustained in the work environment. It's important to assess your workplace and adjust accordingly to the zones indicated on this slide. So we have our repetitive access or primary work zones for those items used constantly throughout the day, such as the keyboard, the mouse, and those kind of things. Occasional access for the items used often, like telephone, notepads, and the seldom access for any items that's rarely accessed during the day. So it's important to remember that positioning and the environment should be considered prior to equipment prescription. Looking at ideal office chairs, so chair height, the seat should be positioned so that the feet are firmly on the floor or a footrest with thighs approximately parallel with the floor. The seat pan should be rounded with a waterfall edge to prevent contact stress and provide sufficient support for the thighs in length and width. Seat pans should not be severely contoured, as this can limit different seated postures, but slight contouring which will prevent the pelvis from sliding forward. The backrest should exert a comfortable pressure on the back while not pushing the user out of the seat and provide easily adjustable lumbar support to fit the natural curve of the lower back. Finding the right position for the lumbar support can be achieved by starting at the highest point and decreasing it in height. The backrest should also provide forward and rear adjustment for recline or upright sitting. So we look at a stable 5-star base as well, adjustable height range suited to the desk, suitable seat width and depth for the user, a stable independently adjustable backrest, free moving casters when used on the carpet or glides to be using on a hard floor surface, and looking at the chair's armrests, so if it has them, appropriate height, the elbows are able to be bent at 90 degrees, shoulders are relaxed, and it shouldn't prevent the chair from pulling into the desk. And we have the waterfall edge there as well. Different seating options, so we have our saddle seat, which promotes anterior tilt of pelvis to facilitate getting into the right position to maintain your lumbar curve. Sit-stand chair, this position may be considered when a person must repetitively reach forward into their tertiary zone or reach upwards. Sit-stand chairs place the person in a semi-seated position, which facilitates torso support and lumbar lordosis, while making it easier for them to get up and stand to reach faraway items. The kneel-sit chair, so some people find it very comfortable and others don't. They are designed to take the pressure and strain off your lower back by distributing your weight through your buttocks and knees. They also open up the hip angle, which promotes lumbar lordosis. There is a disadvantage, which includes the lack of ability to change leg position, can lead to fixed posture, and the need to use stomach and back muscles to maintain trunk posture. High back chair, available to support the upper back, and neck. And they're good for recline settings such as using the telephone or improving back comfort. And then we have the little stool at the end. They can be a great option for mechanics or therapists even working with kids who need to get down to a lower level and move around as well. You do need to engage your stomach and back muscles to keep the upright posture due to the lack of back support. Household items. So there are a range of cleaning devices and products that can make life easier at home when back pain is present. Foot-operated bin. So there is a device which can be hooked up to a wheelie bin to allow someone to use their foot to open it. It can be helpful to avoid awkward postures when putting rubbish bags in and allow for the user to have both hands free. The iRobot vacuum cleaner. So this is a vacuum cleaner that automatically vacuums the floor. It's a disc-shaped device that automatically moves around the floor vacuuming. It has sensors which prevent it from colliding with walls and furniture. And it automatically returns to its home base to dock and recharge between vacuuming sessions. The long-handled dustpan. So this is fabricated from lightweight materials that can be useful for people who have difficulty bending over. And the long-handled toilet brush assists the user to remain in an upright position when cleaning the toilet, eliminating the need to bend. Other general household items, so we have the long-handled reacher, allowing for the user to pick up and reach small objects without bending so much. They do come in various lengths, and it's important to remember that generally the longer the reacher, the more limited control the user has. Some brands do have a magnetic feature that can assist with picking up metallic objects. And also the perching stool. So these are great for people who have limited endurance when standing. Perching stools can be used at the kitchen bench when cooking to allow the user to complete the task in a perched position, alleviating the pressure on the lower back. Mrs. Peg's handy lines. So these are folding lightweight clotheslines for indoor and outdoor use and provide 6 meters of drying space. They are useful for people with decreased strength and difficulty reaching or lifting above their shoulder height. The height can be customized for individual needs, so for wheelchair users, and there are 2 sizes available. And then we have our kitchen trolley. So these are rigid steel-framed, lightweight kitchen trolleys with quite adjustable handles and handbrakes designed for indoor use. There are 2 removable trays on the one pictured, which clip onto and it also has solid rubber casters which swivel on the front and are unidirectional on the rear. So these can be useful when taking dinner plates over to the table, or medications or television remotes. Recreation and leisure. So a bit of gardening. So we have our raised garden beds. So these provide an elevated garden planter for people who have difficulty accessing garden beds. It can be used to grow flowers, herbs, or small vegetable plants. Garden kneelers. So these are devices to assist the user to kneel down to reach a garden bed. Provides 2 sturdy handles to assist the transfer, as well as a padded platform to kneel on. Long-handled garden tools, eliminating the bending and awkward postures during gardening tasks, and there are various tools available. Bowling ramps. Eliminates the requirement to lift the bowling ball, can be found at most bowling alleys, so it can simply be pushed down the ramp on the bowling alley. The bowling arm pictured down the bottom, so this is a long-handled device that enables the user to pick up, carry and deliver a bowl or jack without bending. Constructed from marine-grade steel alloy with a green polyester finish. It's available in 4 sizes with a palm or thumb release. And then we have the pool cue rest. So this is just something that's available with most pool tables, but it can be utilised when the cue ball is out of reach to limit awkward positioning and bending. So in conclusion, back pain is very subjective. People may experience symptoms differently depending on their conditions and what activities they take part in, as well as many other contributing factors. Assistive technology is not the sole solution, although it may assist to relieve some symptoms or pain in certain situations. It is always important for people to complete some research and seek advice from the health professional. Utilising LifeTec as a resource, so we have thousands of products in our database and can assist you in finding something suitable for your client. So we provide advice with our inquiries line of display centres, so clients can come in and try out various products to test suitability prior to purchase. Consultations, so we do this in-centre, in clients' homes or during outreach. And education for workshops, other webinars. So please see our website for more information. So that concludes the presentation today. Please email me if you do have any questions. And our door is always open. So that's just, we're in Newmarket and Domain Central, our general email, website and our inquiries number. Thank you for listening and I hope you enjoyed the presentation.